Have you ever looked in the mirror and wondered why your stomach keeps getting larger, even though the rest of your body hasn't changed very much? Maybe you've been eating less than you used to. You've cut back on desserts. You've started taking evening walks. Yet your waistline continues to grow. If that sounds familiar, you're certainly not alone. Many adults over 60 tell me the exact same story. They don't understand why the weight seems to settle around the abdomen, why they feel exhausted halfway through the day, or why losing belly fat has become so much harder than it was 20 years ago. Most people assume it's simply part of getting older, but age alone is rarely the entire explanation. Over the years, I've learned that this pattern is often connected to several changes happening inside the body at the same time. Sleep becomes less restorative. Muscle mass gradually declines. Daily movement decreases. Blood sugar becomes more difficult to control. Stress lingers longer than it used to. Individually, each of these changes may seem small. Together, they can create an environment that encourages the body to store more fat around the abdomen. Today, many people refer to this as a cortisol belly. It's a popular term, but it's important to understand what it really means. There is no official medical diagnosis called cortisol belly, and you cannot determine whether cortisol is the cause simply by looking at someone's stomach. Belly enlargement can happen for many different reasons, including changes in body composition, digestive conditions, medications, fluid retention, or other medical problems. However, there is strong scientific evidence that chronic stress, poor sleep, insulin resistance, and excess visceral fat often influence one another. Instead of acting independently, they form a cycle that becomes increasingly difficult to break. That's why so many people become frustrated. They focus only on eating fewer calories. They push themselves through exhausting exercise routines. For a few weeks, the scale may move, but before long, the weight returns, and the belly seems just as stubborn as before. The problem isn't always a lack of effort. Sometimes it's that the body is receiving conflicting signals about how to use and store energy. That's exactly what we're going to explore today. I'll explain why fat around the abdomen behaves differently from fat stored elsewhere in the body, why stress and blood sugar matter far more than most people realize, and most importantly, what you can do to interrupt this cycle using practical habits supported by current medical research. But before we discuss solutions, you first need to understand why one particular type of belly fat deserves much more attention than most people give it. Because not all abdominal fat behaves the same way. And that distinction changes everything. Now that we've established that not all belly fat is the same, let's take a closer look at why that distinction matters. When most people think about body fat, they imagine it as nothing more than stored calories. Eat too much, gain fat. Eat less, lose fat. While that's partly true, it doesn't tell the whole story. The fat you can pinch just beneath your skin is called subcutaneous fat. Although having too much of it isn't ideal, it generally behaves differently from another type of fat that sits much deeper inside the abdomen. This deeper fat is known as visceral fat. Instead of resting beneath the skin, visceral fat surrounds organs such as the liver, pancreas, and intestines. Because of its location, it isn't simply stored energy waiting to be burned. It's metabolically active. That means it constantly communicates with the rest of your body by releasing chemical signals that can influence inflammation, blood sugar regulation, and the way your body responds to insulin. As visceral fat increases, those signals can gradually become less helpful and more disruptive. Researchers have also found that visceral fat contains higher activity of an enzyme called 11-beta-HSD1. While the name sounds technical, its role is fairly straightforward. This enzyme can increase the amount of active cortisol within certain tissues, including fat tissue itself. That doesn't mean everyone with a larger waist has dangerously high cortisol levels, but it does help explain why chronic stress and abdominal fat often reinforce one another instead of acting as completely separate problems. Now imagine what happens over several years. You begin sleeping a little less than you used to. You're under more stress caring for family members, managing finances, or dealing with health concerns. You exercise less because your knees hurt, or because you simply don't have the same energy. Muscle mass slowly declines, something that naturally happens with aging if we don't actively work to maintain it. Meals become less structured and snacking becomes more frequent. Each of these changes may seem insignificant on its own, but together they gradually reduce your body's ability to use glucose efficiently. The pancreas produces more insulin, fat storage becomes easier, and visceral fat slowly expands. Then, the cycle starts feeding itself. More visceral fat can contribute to poorer metabolic health. Poor metabolic health makes it more difficult to burn stored fat. Lower energy leads to less movement. Less movement contributes to further muscle loss. And before long, many people find themselves wondering why nothing seems to work anymore. This is exactly why focusing only on calories often leads to disappointment. Your metabolism is influenced by much more than how much food you eat. Sleep, physical activity, muscle mass, meal timing, stress management, and insulin sensitivity all work together every single day. Ignoring any one of those factors is like trying to row a boat with only one paddle. The good news is that this cycle isn't permanent. Once you understand how these systems interact, you can begin sending your body a different set of signals that encourage better energy regulation instead of continued fat storage. And surprisingly, one of the most powerful places to begin isn't your diet. It's your daily stress rhythm and the quality of your sleep, because those two factors influence almost everything else we're about to discuss. At this point, you might be wondering something. If stress plays such an important role, does that mean cortisol is simply a bad hormone? Not at all. In fact, without cortisol, you wouldn't be able to wake up in the morning, maintain normal blood pressure, or respond to everyday challenges. Cortisol is essential for life. The real problem isn't cortisol itself. It's when your body's natural rhythm begins to break down. Under healthy conditions, cortisol follows a predictable daily pattern. It rises shortly before you wake up, helping you feel alert and energized. As the day goes on, it gradually declines, allowing your body to slow down, relax, and prepare for sleep. Unfortunately, many adults no longer follow that rhythm. Late-night television, endless scrolling on phones, irregular sleep schedules, emotional stress, financial worries, and even untreated sleep disorders can all interfere with this natural cycle. Instead of feeling refreshed in the morning and sleepy at night, many people experience the exact opposite. They struggle to get out of bed, their energy crashes during the afternoon, then, just when it's finally time to sleep, their minds become wide awake. This doesn't just leave you feeling tired. Poor sleep changes the hormones that regulate hunger. Research has shown that inadequate sleep can increase levels of ghrelin, the hormone that stimulates appetite, while reducing leptin, the hormone that helps you feel satisfied after eating. The result is something many people recognize immediately. You aren't necessarily craving grilled chicken or fresh vegetables. You're craving cookies, chips, pastries, ice cream, or whatever gives your brain a quick burst of energy. That's not simply a lack of discipline. It's your body trying to compensate for exhaustion. Over time, this creates another layer of the cycle. Less sleep leads to stronger cravings. Stronger cravings often lead to more highly processed foods. Those foods can produce larger swings in blood sugar and insulin. Energy becomes less stable, making you feel even more fatigued the following day. And when you're tired, exercising or preparing healthy meals becomes much less appealing. I've seen this happen countless times in my own patients. Many believed they lacked motivation. In reality, they were trying to solve a sleep problem with willpower alone. Once they began improving their sleep habits, they often noticed something surprising. Their cravings became easier to manage. Their energy became more consistent. Making healthier food choices required less effort than before. That's why I rarely tell someone to focus only on losing weight. Instead, I encourage them to build an environment where healthy choices become easier to make naturally. Because when your brain is well rested, your body is much more willing to cooperate. And that's where our first practical strategy begins. When people decide they want to lose belly fat, the first thing they usually do is search for the perfect diet. Should they cut carbohydrates, try intermittent fasting, eliminate sugar completely? While nutrition absolutely matters, most people overlook something even more fundamental. Your body responds to the signals you send it every single day. And one of the strongest signals is your daily rhythm. Think about how your day begins. Do you wake up at roughly the same time each morning? Do you spend a few minutes outside in natural daylight, or do you immediately reach for your phone while remaining indoors for the next several hours? It may seem insignificant, but morning light helps regulate your internal body clock. A consistent sleep and wake schedule helps reinforce the natural rise and fall of cortisol throughout the day. That rhythm influences not only sleep, but also appetite, energy levels, and metabolic function. The next habit is surprisingly simple. Try to create a longer overnight break between your final meal of the evening and breakfast the following morning. For many people, allowing 12 hours without eating overnight is both realistic and sustainable. For example, finishing dinner around 7 in the evening and eating breakfast around 7 the next morning. This isn't about starving yourself, it's about giving your body a predictable period without constant digestion and repeated insulin spikes. Just as important is reducing unnecessary stress whenever possible. That doesn't mean eliminating every stressful situation. None of us can do that. Instead, it means helping your nervous system recover more effectively. A short walk outdoors, reading instead of scrolling before bed, deep breathing for a few minutes, gentle stretching, talking with a friend. Small habits like these may seem insignificant, but when practiced consistently, they can help your body shift away from remaining in a constant state of alertness. Some people also ask about supplements such as magnesium or ashwagandha. While certain supplements may be appropriate for some individuals, they should never replace the foundations we've discussed. No supplement can consistently overcome poor sleep, chronic stress, or an unhealthy daily routine. Think of supplements as supporting players. They should never become the main strategy. The encouraging news is that improving your daily rhythm often produces benefits long before the number on the scale changes. People frequently report sleeping better, waking with more energy, thinking more clearly, and feeling less hungry throughout the day. Those changes make the next step much easier, because once your body is operating on a healthier rhythm, you can begin addressing another major driver of stubborn belly fat. And that driver is the way insulin responds to the foods you eat every single day. Now that we've talked about restoring your body's daily rhythm, let's turn our attention to another key piece of the puzzle: insulin. Many people think of insulin only in relation to diabetes. But even if you've never been diagnosed with diabetes, insulin still plays an essential role in determining whether your body stores energy or uses it. Every time you eat carbohydrates, your digestive system breaks them down into glucose. That glucose enters your bloodstream, where insulin acts like a key, helping move it into your cells to be used as fuel. This is a completely normal process. Problems begin when insulin remains elevated far more often than it should. For many adults, that doesn't happen because they're eating enormous meals. It happens because they're eating almost constantly. Breakfast is followed by a mid-morning snack, then lunch, an afternoon snack, a sweet coffee, dinner, and perhaps something else while watching television before bed. Each time food enters the body, insulin rises again. If this pattern continues day after day, your body spends very little time accessing stored fat for energy. Instead, it becomes accustomed to relying on a continuous supply of incoming calories. Over time, some people also become less sensitive to insulin. When that happens, the pancreas has to release even more insulin to produce the same effect. That's one reason abdominal fat can become increasingly stubborn with age. Fortunately, improving insulin sensitivity doesn't necessarily require an extreme diet. In many cases, simple habits can make a meaningful difference. One of the most effective is prioritizing protein at each meal. Protein helps support muscle maintenance, slows digestion, and often keeps you feeling satisfied longer than highly processed carbohydrates alone. Adding fiber-rich vegetables, beans, whole grains, and healthy fats can have a similar effect. Instead of causing a rapid rise and fall in blood sugar, balanced meals provide a steadier release of energy throughout the day. Another helpful strategy is reducing mindless snacking. Many people snack not because they're physically hungry, but because they're bored, stressed, or simply following a habit they've repeated for years. Learning to recognize the difference between true hunger and emotional eating can be surprisingly powerful. That doesn't mean you should ignore hunger. It simply means asking yourself one question before reaching for food. Am I eating because my body needs energy, or because I'm trying to change how I feel? Often the answer is revealing. When meals become more balanced and eating becomes more intentional, many people notice something encouraging. Their energy becomes steadier, their cravings become less intense, and losing abdominal fat no longer feels like an impossible uphill battle. But there's one more factor that deserves just as much attention, because even the healthiest diet cannot fully compensate for something your body naturally loses with age: muscle. If I could choose only one habit to recommend for preserving long-term metabolic health after 60, it probably wouldn't be a particular diet. It would be protecting your muscle. Most people think of muscle simply as something that helps us stay strong. In reality, muscle does much more than that. Healthy muscle tissue acts like one of the body's largest storage sites for glucose. After a meal, Muscles help remove glucose from the bloodstream and use it for movement and repair. The more healthy muscle you maintain, the more efficiently your body can handle the food you eat. Unfortunately, beginning around middle age, adults naturally lose muscle every year unless they actively work to preserve it. This gradual decline is known as sarcopenia. It's one of the reasons everyday activities begin feeling more difficult over time. Climbing stairs, carrying groceries, standing up from a low chair, walking longer distances. As muscle declines, metabolism often slows as well. Daily calorie needs decrease. Blood sugar becomes more difficult to regulate, and the body becomes more likely to store excess energy as fat. This is why strength training is so valuable. Many older adults worry that lifting weights is dangerous or only appropriate for younger people. The truth is that properly supervised resistance exercise can be one of the safest and most beneficial forms of physical activity for healthy aging. You don't need to become a bodybuilder. Simple exercises using resistance bands, light dumbbells, or even your own body weight can stimulate muscle maintenance. Combined with adequate protein intake, these exercises help your body continue using glucose efficiently instead of storing it unnecessarily. Walking also deserves tremendous credit. In fact, one of the simplest habits supported by research is taking a short walk after meals. Even 10 to 15 minutes of comfortable walking can help muscles absorb glucose more effectively, reducing large blood sugar spikes after eating. Small habits like this often produce remarkable results when repeated consistently. The goal isn't perfection. The goal is consistency. You don't have to exercise intensely every day. You don't have to eliminate every favorite food. You don't have to transform your life overnight. Your body responds to repeated patterns, not isolated moments. Every healthy meal, every walk, every good night's sleep, every strength training session. Each one sends your metabolism another signal that it's safe to become healthier. And over weeks and months, those signals begin adding up. By now, we've connected all the major pieces of the puzzle: stress, sleep, insulin, visceral fat, and muscle. Now it's time to bring everything together into a practical plan that you can realistically follow, while also discussing when persistent abdominal weight gain may be a sign that it's time to speak with your doctor. If you've stayed with me until now, you've probably noticed something important. This conversation was never really about chasing a flatter stomach. It was about understanding what your body may be trying to tell you. For many adults, increasing abdominal fat isn't simply a cosmetic concern. Sometimes it's one of the earliest visible signs that sleep quality, blood sugar regulation, muscle health, stress, and daily habits are no longer working together as efficiently as they once did. The encouraging news is that these changes often develop gradually. And because they develop gradually, they can often be improved the same way. Not through extreme diets, not through exhausting workouts, not through miracle supplements that promise impossible results, but through small, consistent habits that allow your metabolism to recover over time. Let's briefly review the most important steps. Protect your sleep whenever possible. A consistent sleep schedule helps regulate the hormones that influence hunger, energy, and recovery. Move your body every day. You don't have to spend hours in the gym. Walking, especially after meals, is one of the simplest ways to support blood sugar control and overall metabolic health. Preserve your muscle. Resistance exercises performed 2 or 3 times each week can help maintain strength, improve insulin sensitivity, and support healthy aging. Build balanced meals. Prioritize protein, vegetables, fiber, and healthy fats while limiting highly processed foods that leave you hungry again shortly after eating. And finally, be patient with yourself. Your body didn't change in a few weeks. It's unrealistic to expect it to recover in a few weeks either. Real progress is usually measured in months, not days. You may notice that your energy improves before the number on the scale changes. You may sleep better before your waistline becomes smaller. You may feel stronger before your clothes begin fitting differently. Those improvements matter because they often signal that your metabolism is moving in the right direction. At the same time, it's important to remember that persistent abdominal enlargement should never be dismissed automatically as just getting older. If your waistline is increasing rapidly, if you develop severe fatigue, unexplained weight loss, persistent digestive symptoms, swelling, or significant changes in your overall health, don't rely on internet videos for answers. Schedule an appointment with your healthcare provider. A proper medical evaluation can identify conditions that require treatment and help determine whether your symptoms are related to hormones, medications, metabolic disease, or another underlying health problem. The goal is never to create unnecessary fear. The goal is to recognize changes early when there are often more opportunities to improve your health. Your body is constantly adapting to the choices you make. Every healthy meal, every walk, every strength training session, every extra hour of quality sleep. Those decisions may seem small on their own, but together they shape the direction of your health for years to come. Thank you for spending this time with me today. If you found this information helpful, please consider subscribing so you don't miss future videos on healthy aging, nutrition, and evidence-based strategies for staying active and independent after 60. Until next time, take care of yourself, stay curious, and remember that it's never too late to make choices your future self will thank you for.